Hello, everybody, and welcome to Community Conversations. My name is Luke Margolis. I'm the Corporate Communications Director for Atlantic Health System. And today, for my conversation, I am joined for the second time, making his triumphant repeat appearance here on Community Conversations, by Dr. Michael Girardi. He is an emergency medicine physician, part of Atlantic Health System. And Doctor, you were a tremendous help for us on the last episode. You were here when we talked a lot about allergies and some of those complications. Today's topic, where to go for care. So thanks again for coming back.
Thanks for having me, Luke. I always enjoy talking with you.
Great. We're going to cover a lot of ground here today, folks. But before we do, just want to give you a little bit of the nuts and bolts on how this works. So if you miss any portion of our live conversation today, I encourage you, please subscribe to our YouTube channel. It's where all of our community conversations come through, in addition to all of the amazing content our team pumps out pretty much every day. So that's the best way to stay on top of it. You can also go to our website, atlantichealth.org, where our community conversations reside as well. Great resource for other healthcare information too. Looking for a physician? Click on Find a Doc. Looking for information about a specialty? Type it into the little search bar on the website. You can find out all kinds of great info there. And of course, though, we appreciate you joining us live. If you want to engage in our conversation as well, look, Dr. Girardi and I have tons of fun stuff to talk about. But if you want to get involved, please submit a question in the text field there on your screen. We will try to get to as many of those as we can. One thing to ask. Really, two things, really. One, keep them on topic. We are really here to talk about a specific thing, so keeping it on that topic will be most helpful. And the second one is, we try really hard not to diagnose people through YouTube. So if you have a specific concern that's really best directed to your physician, I would encourage you to direct it there. Dr. Girardi is a master of all things, no doubt, and we will try to cover as much ground as we can, but your specific issue is best directed to your physician. So with all of that having been done, you ready to go?
Absolutely, let's go.
Okay, cool. This is a conversation I'm sure you engage with every day, pretty much. This idea of what's the best location for you, patient X, for your specific condition. I guess our first takeaway, there's a lot of options for people, right? So what are some of the conversations you engage in on this topic, and what's sort of the first thing you want people to think about when they're thinking about where to go to seek care?
Well, they usually have a relationship with a primary care physician, and they should have a discussion ahead of time. Now we get to different levels. Offices are closed, or they can't fit you in that day, you go to an urgent care. The next step up would be people think an emergency department. But we're here today to focus on a new option, these advanced care medical practices. The advanced ED capitalized urgent cares that Atlantic has created two, and there are going to be two more in the next 4 months.
So it's really that filling in the white space between what some folks might consider to be a traditional urgent care issue and a emergency department issue.
Right. So as an emergency physician, we're the ones who are staffing these emergency nurses, these advanced care medical practices, so we are very comfortable handling emergencies. So where you thought you had to go to the emergency department, there's another option for you. And we have to clarify, urgent cares, 84% are staffed by non-physicians, whereas these advanced care medical practices are always staffed by an emergency physician with a PA by their side or nurse practitioner and emergency nurses. So we're all experienced, we've all come from the emergency medicine space. And that's why when we go through some vignettes here, I think people, our viewing audience will understand with our options.
We do have a couple of things that were shared with us ahead of time by our audience members, so thank you so much for sending those in. And some of them are specific to maybe one of those four areas of care that the doctor referenced a short while ago. So thanks to everybody who submitted a question, and to those who were waiting to do so, now's your time. Please feel free to put it in there. But before we get in there, before we dig in deep into each one of these, you and I were speaking briefly before we jumped on the air with you guys, and we talked about the value of knowing what's around you. Right. This idea of pre-planning. Can you talk a little bit about what you want people to, what does that mean for folks who are sitting at home wondering that?
Right, you don't have to deal with your emergency or acute crisis when it happens. You're gonna have to deal with it, but you have to plan ahead.
Right.
This is why you talk with your primary care physician and their preferences or their recommendations, but you also look, you say, if I have a runny nose or a cough, I think an urgent care can handle it. See the ones that fit your style. Sure. If you have let's say you have a tracheostomy or
something a little more
complex, like
complex,
a special healthcare needs child or something, we have special equipment that's needed in specialists, then you need to know where to go when they get into those type of issues.
Sure.
But there's 99% of what you're going to need is more generalized and it's acute and you don't know where to go. And that's what we're here to talk about today.
What about for parents with kids? I mean, really important to have that understanding ironed out ahead of time too?
Yeah, absolutely. And I think that parents yet understand that what our capabilities are at these advanced care practices. We see patients of all ages, 0, through
During the
teenage years
0 to
100. 110, right. So we have our practice in Mountain Lakes. We see a lot of 80, 90-year-olds are very active.
I'm sure.
They're falling off roofs and, they're very active.
You don't want me on the roof, I'll tell you that. And I'm not
But
that
let's
old.
talk about that, like a person with tracheostomy, someone
Right.
wired in. That's an airway issue. So there's certain things you need to go to the emergency department directly. And then we'll talk about everything else you don't necessarily have to. If you have symptoms of your airway closing or you have a problem with your tracheostomy, that's very specialized. You need to go to the hospital because you may need a surgeon, you may need an ENT specialist.
Sure.
If you had a history of heart attacks and you have a couple stents, and you go, oh, this feels like my prior heart attack.
Yeah.
Then you need to go to the hospital directly because if you come to us, we'll do the EKG and we could start treating you. But an acute MI or heart attack should probably go right to the hospital. The third, strokes. Time is
yeah.
brain, time is muscle for the heart. If you weakness on one side of your body, numbness on one side of your body, change in mental status, you need to go directly to the
To
emergency.
ED.
Now that we got that out of the way,
There's a whole variety of other things we can talk about.
go ahead. Let's talk about a broken bone.
Yeah, I was going to say we've got a lot of kids in the summertime right now, or adults in the summertime, very active, very outdoors. Maybe you're not sure if it's a broken bone or a severe sprain, or maybe you definitely know you have a broken bone. Can you handle that in advanced ED?
Yes, we can. If it's an open fracture, you see bone coming through the skin, go to the ED.
All right.
Anything else, we can see. Most fractures don't have to be taken care of that day. We have to be immobilized, make the diagnosis, we have X-ray.
Of course, sure.
But we'll immobilize it and we'll get you orthopedic follow-up. This is pediatric patients as well as adult patients. A lot of fractures could just be stabilized and they can be seen within 2 to 3 days.
What about that topic you and I talked about a while back? Maybe you're having an allergic reaction to something or something along those lines. Where best would you want to go for something like that?
The nearest facility, which
Yeah.
could be us. You probably have an EpiPen if you have a history, but if not, if your tongue is swelling, that's an airway issue. Remember, airway.
Right,
Go to
right.
the ED. But if it's not an airway issue, you're flushing, you're nauseous, you're getting red, and your skin's getting red, then take an EpiPen or come to us. We'll give you Epi and we'll watch you and get you home.
Excellent.
By the way, 98% of our patients go home.
98%. So that, it's only that 2% of patients who need a higher level of care once they've come to that advanced
Correct.
ED.
Like maybe they broke their hip. They're
Right.
going to need surgery.
Right.
Or there's certain medical issues that need to go to the hospital. But about 1% of what we see ends up getting admitted.
So right now, the advanced ED locations here at Atlantic Health System, and these are unique to Atlantic Health System, by the way, are in Paramus and Mountain Lakes, right?
Yes.
Excellent.
Now, Mountain Lakes is right across from Paul's Diner. That's where people find it. Paramus is by Stu Leonard's. Everyone knows where that is.
Okay, good.
And then we're opening up in Bayonne in September.
Okay,
And then we're going to be Clark. We're changing the urgent care there to a more advanced practice.
okay,
Now, the reason that these are unique sites is that we have CAT scan there, lab,
okay,
and X-ray.
okay.
Emergency physicians, emergency nurses. It's like walking into a remote acute care. We can't call them emergency departments, but
Sure.
we have just about everything you have in an emergency department.
What's the difference? I mean, we sort of we do a nice compare and contrast with an ED and advanced ED. Urgent care. How would you describe the difference between an advanced ED and an urgent care? Is it size? Is it capability? What stands out to you when we talk about compare and contrast?
Well, remember the staffing. 85% of urgent cares are staffed by nurse practitioners and PAs, but not emergency physicians.
Got it.
We have CAT scan and full access to labs that we need, and X-ray, and emergency nurses and emergency docs.
Okay.
We don't run away from challenges.
Right.
You come in with abdominal pain or chest pain, we're not saying, well, turn around. We say, come on in, and we'll see what's going on.
Sure. Again, folks, as a reminder, if you have any questions around where to seek care, or perhaps you've got young kids and you're wondering where best to take them for the issues that they face all the time, please feel free to drop that into the chat section on the screen in front of you, and we will try to get to as many of those questions as we can.
Yeah, remember, there's a pediatric ED in Chilton, there's a pediatric ED at Overlook, and there's a Gordy Children's Hospital at Morristown.
Sure. And in fact, that's a great opportunity to remind folks, if you're curious about where some of these locations are in relation to where you are, you can go to our website, atlantichealth.org, and there's a locations tab at the top where you can find out the addresses to all of these different types of locations we're talking about. If you want to jump right to information about our urgent cares specifically, you can go to atlantichealth.org/urgent care. Nice vanity URL, easy to remember, and that will take you directly to those locations, that location's website, so you can find out address, phone information, hours of operation, all of that good stuff. We talked about kids. What about folks on the older side of the spectrum?
All right, let's talk about head injury.
Sure.
You fall and hit your head. You're over 65. Chances are you're going to need a CAT scan. Come on in. We can do it at these advanced care medical practices. If you're on an anticoagulant and you really don't think your having an intracranial bleed, but just need to be, by protocol, you need to have a CAT scan.
Sure.
We can do that as well. So let's talk about older patients. Let's talk about
Yeah.
abdominal pain.
Okay.
We have a lot of sandwich generation people in this area. In other words, you're taking care of your mother or your father and your kids, right?
Got it. Yeah.
And so your mom or dad has abdominal pain. You suspect it could be diverticulitis, or you're not sure what it is.
Yeah. Maybe you have no idea. Right.
So we could do the X-rays and the CAT scan with and without contrast, with contrast as necessary. And let's say you have diverticulitis. That's inflammation of the bowel where it gets a mild infection. We could start IV antibiotics at the care center and send you out on oral antibiotics, just like they would do in the emergency department. Now, if we find an abscess or collection of pus, then you'll need to be referred. But that's at 1 or 2%.
But that's that
Small.
small group
No.
of people.
So don't be afraid to come to be seen if you have abdominal pain. And if suppose you have appendicitis, well, then you're going to the hospital.
Right.
But a lot of times you don't.
Yeah.
So we do the whole workup and you go home.
I want to talk a little bit about that transfer to a higher level of care, if need be, for that small percentage of people, or really for anybody who's sought care, maybe even at their primary care physician's office. Can you talk about the electronic medical record, how information can sort of travel with people throughout this process?
All right. Electronic medical records are really been improving healthcare in a lot of good ways. But we were very reticent because that was time at the keyboard.
Sure.
But the better we get at it, the more I love it.
Physicians you're talking about.
Yeah.
Yeah.
I could press something called Secure Chat. I can contact your physician if they're in the system, and they usually respond quickly. Like, I've got Mrs. Jones here. I want to get her follow-up, or I want to need a consultant. Who do you like to use? Then they respond very quickly. So we have all your records, and you know, there's not, even if you don't have Epic system that we have, it access through this health exchange, what hospitals you've visited or what medications.
So no matter where you enter into our doors,
yes,
you're covered.
it saves a lot of time. You know, you don't have to answer all a million questions because it's right there.
Sure.
It's really, it creates a continuum of care and accuracy and safety, which I enjoy.
And a convenience factor as well. Are these facilities are open throughout the days? Can you talk about how accessible these advanced ED locations are for patients who may need it?
Yes, our volume, when people show up, we call them volume curves. In emergency departments tend to be later in the day. These tend to be busy in the morning.
Okay.
So remember that if you've got things to do, you may have to wait in the mornings more than in the middle of the day or afternoon. We're open 8 to 8 on weekdays and 8 to 5 on weekends, and we're open on holidays.
Excellent.
Because we know we have a lot of bagel cuts and stuff on weekends and cutting the turkey.
Sure.
And we do lacerations, sutures.
We do have a question that's come in. Folks wondering, so we talked about the 4 different levels: primary care, urgent care, advanced ED, and then ED. There was a person with a question about the difference between the top 2, right? Like, what is something that I would go to my primary care physician for versus something that I might go to an urgent care for, or vice versa? Let's talk about those top 2 options.
The 2 clarifications would be, can they fit you in that
So
day?
the ability to be seen,
remember the
right.
COVID surges? Nobody had.
Sure.
And number 2, you need an X-ray. Some offices do not have X-ray.
A doctor's office might
not have
that
X-ray
capacity.
But almost everything that urgent care does, a primary care physician can do. But lacerations, that's see who your local resources are. Some urgent cares, some primary care practices do some simple lacerations or abscess drainages.
You and I, have, like I mentioned, have talked about, you've been on our program before. You and I have talked many times over the years with the media and other folks. Let's just, from a broad strokes perspective, how transformative have the last few years been in our ability to provide care conveniently for people? When you think about where just the field was in years past versus where we are now, how impressive has it been to see it evolve over time like this?
You caught me off guard with that question, but
Well,
I love it. I'll tell you why, because it's a huge web that's developed. You
Yeah.
have outpatient access.
Sure.
You used to have to go to the hospital or
Yeah.
get almost a navigator to get yourself into the system. Now with the different medical practices linked by EMR and
All
the medical
connected.
practice connected, and we communicate with each other, you're going to the hospital less and less.
Exciting time to be
You know,
involved.
diagnostics are moved outside the hospital. The procedures you can do are moved outside. Remember I said I gave IV antibiotics?
Sure, yeah.
The only place you can get that was in the hospital, it used to be. Now, if you come in with a cellulitis or skin infection, it's really bad. I want to give you IV antibiotics. Again, I could do that at our advanced care medical practices.
Sure.
So, to answer your question again, we are having many more touches outside
Sure.
the hospital because having worked there for 30 years, I know what used to come in.
Right.
So we're seeing sicker patients in the hospital.
Right.
Access seems to be harder to get.
Well, volume related.
The volume, right?
Yeah.
Because remember, there's been catch up after COVID.
Sure.
So between
People putting off care and then now re-engaging
Oh,
with the healthcare system.
Oh yeah.
Yeah.
And so we're still catching up with that, and we have to change the protocols in the hospital to provide more protection.
Sure.
So Yeah, the hospitals are a little crowded, but this is bringing the emergency department or those type of services to the community. It's a great value for you. We could talk about billing because it's going to be a global rate.
Sure.
It's not going to be like 10 items you're going to get charged for.
Sure.
But so between the value and the access, we're pretty proud. I think the model's kind of catching on.
Exciting. All right, folks. So we are just about out of time, but I do want to take one. I always like to end these by kind of ending where we started, in case folks who tuned in late missed the very beginning. Dr. Girardi, just as a quick recap for maybe folks who joined midway, 4 sort of different levels of care for people to think about. Let's go through what those are again.
Not so much different levels, but
Or
different types of care.
different
Primary care,
access level, right.
I hope everyone has a primary care physician. But if not,
Your doctor, what might be
Right.
referred to as your doctor.
then there's urgent care, which stuffy nose, cough, colds, simple extremity injuries.
Sure.
Then the advanced care, abdominal
step beyond
pain,
that.
chest pain. We didn't even talk about shortness of breath or chest pain. It's fine. We can take care of that. And then when you have airway issues, strokes, or heart attacks, you probably should go directly to an emergency department.
Serious
or really
levels of
specialty care related, where you know your specialist are and your complicated history.
Either way, folks, we've got you covered. Excellent.
In places you didn't think.
Right.
People used to run to the emergency department, and now they're hesitant to.
Maybe it's the end of their block or something like that instead.
Well, that's where their car knew to go. Remember you said at the beginning also, do your research in advance. You didn't call us. You're making a list for your kitchen, like to grab a bag, like
Yeah, something stuck on the fridge or something
yeah,
like that.
right. So we know your meds now
Right.
because you're in the computer usually.
Right.
But anyway, think ahead because you don't want to be thinking, where am I going to go when your kid is crying
During the actual
or-
emergency.
or you're
right. Right. Very good. Dr. Girardi, thanks so much for joining us again today. Appreciate your time.
Thank you.
All right, folks. So, as I mentioned off the top, covered a lot of ground today. If you missed any portion of this, it will be available in its entirety on our YouTube channel. That's why I encourage you to subscribe there. Otherwise, go to atlantichealth.org, where you can catch all of our previous community conversations, including Dr. Girardi's other one, which was great and totally worth watching as well. On behalf of Dr. Girardi, I'm Luke Margolis. Thanks so much for joining us, and we will see you next time. Thanks again for doing this. I think to the point